Hello and welcome back everyone to this series of videos on drugs that are used in arthroplasty patients. In this episode, let's explore DenosuMAb, commercially known as Prolia. As the name suggests, DenosuMAb is a monoclonal antibody. And now let's understand the mechanism of action of this drug. Osteoblasts secrete rank ligand, and this rank ligand binds to a receptor on the osteoclast surface called as rank. When the denosumab is administered to the patient, it goes and binds to rank ligand, thereby preventing osteoclast formation and its function, which results in reduced bone resorption, indirectly increasing the bone mass. Therefore, it has a role in treating osteoporosis. The onset of action of this denosumab typically seen by assessing the markers for bone resorption. So it decreases markers of bone resorption approximately by 85% within 3 days, and maximal reduction happens by 1 month. And the time to peak of this drug is around 10 days, ranging from 3 to 21 days. And the duration of action of this drug is seen again by assessing the bone markers for resorption, and these markers of bone resorption return to baseline within 12 months of discontinuing denosumab therapy. So the indications for denosumab are osteoporosis, in whom first-line therapies are ineffective or cannot be used, or after discontinuation of teriparatide, the anti-resorptive medications are started like denosumab. So it is indicated in postmenopausal osteoporosis or in any patients with increased risk of osteoporotic fractures or glucocorticoid induced osteoporotic therapy. So the dosage of denosumab is 60 mg once in every 6 months. It is given through subcutaneous route. And the optimal duration is not established, but if the fracture risk remains high even after its therapy, it might be extended up to maximum of 10 years. Beyond 10 years, there is no evidence in the clinical practice. So in long term, it is advised to switch to alternate therapies like bisphosphonates. So the dosage is 60 mg every 6 months. So a few points to remember when we prescribe denosumab to our patients are discontinuation or interruption of therapy. It is recommended that this therapy has to be given every 6 months, and if it is discontinued for more than 1 month beyond next scheduled dose, it poses increased risk of vertebral fractures. Therefore, drug holidays are not recommended once we initiate this therapy. And few points about adverse effects of denosumab therapy in osteoporosis could be pancreatitis like picture with severe stomach and back pain, infection like symptoms like fever and chills, skin reactions, oozing, swelling, redness, bumps over the skin, alterations in the blood pressure, and sometimes patients can also complain of bladder pain. So these are the references for this data presented in this video. So this video gives an overview about denosumab and its role in the treatment of osteoporotic patients.